Welcome to Best Home Remedies. Today, we will be talking about 8 natural cures for erectile dysfunction. Erectile dysfunction, ED, or impotence, is a major challenge for many men today regardless of their age, young, middle-aged, or old. Because erectile dysfunction may be caused by many factors, a health condition, emotional or relationship problems, some kinds of medication, smoking, drugs, or alcohol, an erectile dysfunction cure is possible. Though erectile dysfunction treatment options may include ED medication and surgery, there are also non-invasive or natural erectile dysfunction remedies that may help. Men with erectile dysfunction may experience some or all of these persistent symptoms: reduced sexual desire, trouble getting an erection, trouble keeping an erection. In fact, one common reason many younger men visit their doctor is to get erectile dysfunction medication. Along with erectile dysfunction treatment, the doctor may recommend managing the illness by being more physically active or losing weight. The causes of erectile dysfunction are many, including physical problems like diabetes, heart disease, obesity, high blood pressure, high cholesterol, and even sleep disorders. Medication taken for health conditions can result in erectile dysfunction, as can alcohol and smoking. If ignored, erectile dysfunction can lead to complications, such as an unsatisfactory sex life, low self-esteem, high anxiety, and relationship problems. Getting a partner pregnant also becomes difficult if a man suffers with erectile dysfunction. However, erectile dysfunction can be treated at home without visiting a doctor through the following methods. Commonly prescribed erectile dysfunction treatments include: 1. Exercise is an active erectile dysfunction treatment. There are many lifestyle changes that are erectile dysfunction remedies, but among them, exercise is the ED treatment that can have the greatest impact. Exercise works on several fronts to combat the development of ED and help reverse it once it has become a problem. Exercise improves blood flow, which is vitally important to a strong erection, and improves blood pressure by increasing nitric oxide in blood vessels. Weight-bearing exercise can increase the natural production of testosterone, a significant factor in erectile strength and sex drive. 2. 1 erectile dysfunction remedy is a healthy diet. The foods you eat can have a direct impact on erectile dysfunction. A diet rich in fruit, veggies, whole grains, and fish, and with fewer servings of red meat and refined grains, decreases the risk for ED. A healthy diet also helps to maintain a healthy body weight, which is important because men who have a 42-inch waist are 50% more likely to have ED than men with a 32-inch waist. Also, obesity increases the risk for vascular disease and diabetes, 2 factors that contribute to erectile dysfunction. 3. Sleep is a natural erectile dysfunction treatment. Poor sleep patterns can be a contributing factor for erectile dysfunction. It is a well-known fact that testosterone levels increase with improved sleep, and lower levels are associated with sexual dysfunction. Hormone secretion is controlled by the body's internal clock, and sleep patterns likely help the body determine when to release certain hormones. Adhering to a set sleep schedule is a natural erectile dysfunction remedy, and can help ensure that those signals are clear and consistent. 4. Quit smoking to stop erectile dysfunction. For many men, stopping smoking is an erectile dysfunction remedy, particularly when ED is the result of a vascular disease, which occurs when blood supply to the penis becomes restricted because of blockage or narrowing of the arteries. Smoking and even smokeless tobacco can also cause the narrowing of important blood vessels and have the same negative impact. 5. Limit alcohol to improve erectile dysfunction. Alcohol is a depressant and can cause both temporary and long-term erectile dysfunction. The central nervous system is responsible for releasing nitric oxide, an essential chemical for producing and maintaining an erection, and heavy alcohol consumption depresses the central nervous system, causing it to function less efficiently. Not enough nitric oxide translates to erectile dysfunction. 6. Monitor your meds to end erectile dysfunction. Erectile dysfunction can occur as a side effect of medication taken for another health condition. Common culprits are high blood pressure meds, antidepressants, some diuretics, beta blockers, heart medication, cholesterol meds, antipsychotic drugs, hormone drugs, corticosteroids, chemotherapy, and medication for male pattern baldness, among others. If you think your medication might be causing ED, talk to your doctor, but don't discontinue using it on your own. Some medication must be tapered off under a doctor's supervision. 7. Acupuncture may help with erectile dysfunction. Research has proven the effectiveness of acupuncture as an erectile dysfunction cure. Acupuncture can be beneficial for men experiencing erectile dysfunction as a side effect of antidepressants, including selective serotonin reuptake inhibitors, SSRIs, and serotonin noradrenaline reuptake inhibitors, SNRIs. Sexual side effects of these drugs happen to at least half of all people taking them, and by some counts up to 90%. 8 herbal remedies help erectile dysfunction. There are many herbal remedies that have shown to improve erectile function. 2 natural erectile dysfunction treatments that have shown great promise are red ginseng and pomegranate juice. Ginseng is thought to increase nitric oxide production, leading to improved blood flow. Pomegranate juice is a potent antioxidant and can help prevent atherosclerosis. However, always talk to your doctor before taking any supplements, as they might interfere with other medication you're taking. We hope you enjoyed the video, so don't forget to like and subscribe to Best Home Remedies for more related videos.